What are the new screening guidelines for dense breasts? Imagine discovering that your breast tissue is denser than you thought. Recent updates in screening guidelines aim to help women understand what this means for their health. Breast density refers to the amount of fibrous and glandular tissue compared to fatty tissue in the breast, as seen on a mammogram. Women with dense breasts have more fibrous tissue, which can make it harder to spot cancer on a mammogram and also slightly increase their risk of developing breast cancer. Since September 2024, the U.S. Food and Drug Administration now requires all mammogram reports and patient result letters to include information about breast density. This change helps women become aware if they have dense tissue, which is important because dense tissue can hide tumors and is itself a risk factor for breast cancer. If your report indicates you have dense breasts, your healthcare provider will likely discuss your personal risk and screening options with you. For women with dense breasts, especially those classified as heterogeneously dense or extremely dense, screening recommendations have become more tailored. The National Comprehensive Cancer Network suggests that women with dense breasts start annual mammograms by age 40. They also recommend seeing your healthcare provider every 6 to 12 months for risk assessment and monitoring. The goal is to catch any issues early when treatment is most effective. The U.S. Preventive Services Task Force still recommends annual mammograms starting at age 40 for women at average risk, but it does not specify additional screening solely based on breast density. This is because current evidence does not show enough benefit from extra screening for all women with dense tissue. However, for women with extremely dense breasts, supplemental screening methods are often advised. The UNSASAN recommends that women with extremely dense breasts consider having a breast magnetic resonance imaging scan starting at age 50. If you have additional risk factors like family history or genetic predisposition, your doctor might suggest starting MRI screening as early as age 40. In Europe, the European Society of Breast Imaging recommends MRI scans every 2 for years for women aged 50 to 70 with extremely dense breasts. These additional scans help improve detection because dense tissue can mask tumors on traditional mammograms. Advanced imaging techniques like digital breast tomosynthesis, also called 3D mammography, are increasingly used for women with dense breasts. This technology takes multiple angled images of the breast, making it easier to find small cancers and reducing false alarms. Many insurance plans now cover 3D mammography, but it's always good to check before scheduling your appointment. Other supplemental imaging options, such as molecular breast imaging and contrast-enhanced mammography, are also being explored for women with dense tissue. These methods can provide more detailed pictures, especially if there are other risk factors involved. If you have dense breasts, it's important to understand that your tissue can both increase your risk and make cancer harder to detect with standard mammograms. Talking openly with your healthcare provider about your breast density and personal risk factors can help you develop a screening plan tailored to your needs. This might mean starting mammograms earlier, adding MRI scans, or using advanced imaging techniques like 3D mammography. In summary, the new guidelines focus on making women aware of their breast density through mandatory reporting, encouraging earlier and more frequent screening starting at age 40 for women with dense tissue, and recommending supplemental MRI scans for those with extremely dense breasts, especially around age 50 or sooner if other risk factors are present. These steps aim to improve early detection of breast cancer and give women the best chance for successful treatment. Remember, always consult your healthcare provider to determine the best screening strategy for your individual situation.